It's 4 minutes after noon on the West Coast. My name is Daniel Stein. I'm the president and one of the co-founders of Stewards of Change and the National Interoperability Collaborative. And I am really excited today to welcome you to our first virtual open house for the NIC and invite you to learn about it and engage with the activities we have. The first time we're doing this open house, so it's kind of new to us as well. So while we have an agenda, we're also kind of making it up as we do it, and we invite your participation. We have about an hour scheduled to do this work, and we have just a couple of housekeeping things as we get started here. You can mute your own phone if you want. Right now it sounds pretty good. There's not a lot of background noise. We are recording this and we will post it to the Hub for those folks who couldn't make it and are interested in joining. We do want to hear from you. So we have a chat box on the menu, and you can also raise your hand or just put a note into the chat box. And we do want to have conversation with you. We have a couple of sessions, a couple of times at the end of the webinar to have a Q&A, but we do encourage you as we go through it to raise questions and to share with you about it. And of course, if you haven't already signed up for the Hub, hopefully you'll do so afterwards. And you can add more to your profile as we get into it. You'll see there's a lot of material that's on there, and the more that's there, the more people can really know who you are and what the opportunity is to engage with you. And so with that, I'm going to just get started here, and I'm going to turn my clock on so I'm keeping on my schedule. We have an agenda today that is kind of full here. So we're going to do some welcome. I'm going to do a quick overview of the National Interoperability Collaborative and the Hub itself. Do a quick poll, and we have a special guest, Mike Wilkening, who many of you may know, Senior Advisor on Innovation and Digital Transformation for the new Governor of California, Governor Newsom, is joined us today and will say a few words about what's going on out west and his new role in collaboration. So thanks, Mike, for joining. We'll do a virtual tour of the Hub. You may have probably already been through it, but we want to show you some of the nooks and crannies and some of the opportunities that we're building it out. And we'll have a very brief overview of some of the current. I think I'm gonna mute here, folks. Mute everything. So I'm going to. I'm going to turn it over to some of my colleagues who are on the phone with us to talk about some of the specific current Hub groups, just give you an orientation to a few of them that are operating. And then we will advance. Okay, here we go. Then we're going to talk a little bit about where we're headed and some of the new groups that we're offering, have another quick poll on some information, and then have a quick Q&A as we go through that. So again, welcome. I'm Daniel, and the distinguished panel of speakers today you can see from myself to Mike Wilkening, Sunday's been Chagra, Ivy Poole, Adam Pertman, and Nava Stein, and we'll be your hosts and your guides for today's session. So what is the National Collaborative, or as we refer to it as the NIC? NIC is an idea that has been developing over multiple years, and the fundamental idea is really to provide a virtual space for people who are working in the information sharing and interoperability space to have a place to really come together. Over the years that we've been working, we've noticed that there's a lot of people doing a lot of interesting work, but there hasn't necessarily been a place to be able to bring that, not only the information, there certainly have been repositories, but there hasn't been a place to engage in conversation and share information. So the vision of that, as we call it, is a community of networks. And that community of networks is really designed to really create and enhance collaboration, both within specific domains or sectors or programs, but importantly, across multiple domains. We believe strongly that across domains is a really important place to be at these days for a whole variety of reasons, from whole person care to value-based payment. How do we coordinate across not only social and human services, but also with public health and education and public safety, emergency medical response, and healthcare IT in particular. And in 2018, we wrote a paper called In the Nick of Time, 6 Domains of Primary Focus. And in many ways, this summarizes that idea of the importance of cross-domain work. There's a lot of work going on, and each of these domains, and we don't pretend to say that they're all the domains that are out there, but it's a convenient way of sort of grouping a lot of the work. Many are working very hard at looking at interoperability and information sharing, and struggling with many of the same issues. So as we looked at across those domains, we saw that there were many of the same issues, whether or not it's on the technical side, on the confidential and legal side, and workforce, all sorts of kinds of concerns that everybody's struggling with. We hope to be able to start to bring them together to have some cross-domain conversations. And our managing director of the Kresge Foundation, who's underwriting the NIC, has succinctly put it as NIC is an idea whose time has come. And we're firm believers in that as well. So a few more specific things on the NIC. It does build on more than a decade of our work over at the Stewards of Change Institute. So the NIC is a project of Stewards of Change Institute. And it's really a representation of work that we've done with hundreds, if not thousands, of participants from our events and from webinars and symposia over the years who've been interested in innovation and interoperability and systemic change. And systemic change is really, I think, where a lot of people are these days in terms of trying to understand how do we work across those boundaries. And we refer to that as system of systems idea. So recognize that each system has its own needs, methods, technologies, and how do we bridge across those systems? And so a number of years ago, we came upon this concept of systems engineering from our colleagues at Hopkins, and have been really trying to apply that in this space of health and human services, which really is made up of many, many different systems out there. The NIC itself is built to facilitate bi-directional communication and collaboration, both locally, and as you'll see from some of the groups, there are some very specific localized groups that can be as localized or as national as we or you choose to participate. And we really do want to engage people from all levels, from blind workers to caseworkers, to supervisors, managers, programmers, executive leadership, industry, academia, foundations, to really teach and share and learn. There's so much work that's going on out there, and as we continue to discover, there's a lot of recreating the wheel. In some instances, that's important and positive. But in many cases, we can really expedite our process if we have an opportunity to share and learn from one another. Not only what's working, but importantly, what's not working so well or what hasn't worked, so we don't repeat some of those mistakes and errors as we are wont to do. Right now, the hub is an online virtual entity, but we have plans and are in the process, and I'll share with you shortly some of the ways we hope to be able to bring that on site at other conferences like we did in San Diego and more broadly across the country. One thing that I've been excited about from a concept perspective is this idea that for collaboration to work, everyone needs to be part of it. There's engagement, there's active engagement, and then there's, I guess, a sort of receptive engagement or passive engagement. And as Sundays will show us momentarily, there's been a lot of engagement on the hub, but what we're also asking to is engage people in actually actively participating. And even if it's 15 minutes a week, if we have dozens or scores or hundreds of people doing that, that adds a lot of weight and a lot of interest to the actual conversations that are happening and the topics. And in a way, it's kind of like the Google 20% time, which is how do you spend time during your workday to focus on things like collaboration and communication, which I can confidently say I'm sure are part of everybody's responsibilities is to figure out ways to do that more effectively with colleagues. One of the reasons I asked Mike to join us was the really exciting work that he's been leading and has led in California about making that a reality as part of the operating procedures. And then finally, I want to just acknowledge our main funder, the Kresge Foundation, has supported this work, and they have a very expansive view of interoperability and the connection between health and human services. And I'm also proud to say that they've renewed our grant, so we are operational through a good part of this year or next year to continue to support this work going forward, along with your help. On the websites, as you peruse and meander, you'll find a lot of organizational members. We found a lot of original support when we asked people to join. I think this is as David had said, its time has come. So whether or not they're public health organizations or academic institutions or industry, people want to participate in this conversation. It's nobody's job specifically, so we think of it in many ways as the work that we're doing to support the nation in building that out. Briefly, some of the background for this, which may be useful, is when we launched this in 2017 at our national conference at Johns Hopkins at our national event. We have subsequently held 3 other events, one in California last spring, talking about information sharing in California and beyond. California was one of our inaugural sites, along with Connecticut and Virginia. Then we moved to the New England area, where we brought together 6 New England states to talk about many of the similar topics, but as it related to both intrastate and interstate. And then just a few weeks ago, we had the great fortune of being able to collaborate with our partners in San Diego to support the Community Information Summit, which was the 2nd annual Exchange Summit. And the title, as you can see, is Driving Cross-Sector Collaboration and Data Sharing, which is very much part of what we're doing. I want to point out 2 things. Those of you who know Stewards' work, we do a lot of graphic illustration and facilitation, which you can see on the chart at the bottom right. And this distills, essentially, it's a visual notes from sessions, and we have literally hundreds of these, which we were able to put together in an interoperability gallery in San Diego. And as you can see on the left side of the screen here, just a snippet from that gallery where we put up 30 of the murals and told a variety of stories around the murals over the last 10 years. Many of the learning and topics that we have covered are very applicable, and there's a ton of learning in those. And we certainly hope to be able to use those as we go forward. You can afterwards or at any time go on and look at those. There's a short video that kind of goes through the gallery, and we'll be posting more videos. But the murals themselves, in many ways, provide an overview of a lot of the conversations that we've been having and helping support over the last, really 8-10 years. So I encourage you to do that. The point of showing you these events is to say that there's a national community of thousands of people who have interest in these topics. About 500 people are currently enrolled in the NIC, and we certainly hope to grow that, both the number of people and the level of engagement on that. So that's the quick overview of the background here. I want to do a quick poll here to get your engagement. And for those of you who have done this before, there's 3 questions here. So if you're at your computer, feel free to join in. We want to see where people are calling in from. So take a moment. Hopefully you can all see this, and go ahead and tell us where you're from. And one brave soul. And the 3 questions, great, people are filling that in. Vote early and often, as they say. All right, we'll just give it a couple more minutes. I know that we've got about half the people voting. Keep on going. More answers are squeaking through here. Got 30 responses. Feels like a bit of an auction. Alrighty, well, this gives us a sense of where people are from. We have, I guess the winning group is from the West Coast. Got some couple of folks from the Northwest, Southwest, Midwest. Nobody from the Southeast, or nobody claims to be from the Southeast, and a couple of folks from Midwest and Northeast. So welcome. We have a decent representation from across the country. This idea of the domains is interesting here as well. It looks like we have a larger group from human services, but also we have representation from healthcare, public safety, education, and public health. We use this oftentimes in discussions and interactive sessions to really focus the conversation around around who's in the room and who's speaking and who's in or not in the conversation. And oftentimes, like now, we'll see that nobody at least alludes to being part of the emergency medical response in terms of their primary area of focus. And it's good to see that maybe half of the folks have been at either one of the symposia over the last couple of years, which is terrific, and many people have participated in our events. And there you go. I realized I was not showing you the results. So here we are, and we'll post this, just a sense of who's in the room. So it's a nice disparity, a nice distribution of folks there. And with that, what I'd love to do here is ask Mike Welkening to come in and say a few words. So Mike, welcome. I'll unmute you there, or if you haven't, there you go.
Perfect. Can you hear me?
Yeah, welcome.
Great. Yeah, good morning. I guess good afternoon to those of you on the East Coast. I'm happy to join you today. And so many of you I've interacted with in the past in my prior roles as Undersecretary and Secretary of Health and Human Services for California. And as of April, I was appointed by Governor Newsom as his special advisor on innovation and digital services. And so in that role, my primary job at the moment is trying to bring up the Office of Digital Innovation, which he proposed in January. So working with the legislature to try to get funding there. We just put out the job announcement for the director yesterday. So there's been a lot of tweets regarding that. And we're looking for a really dynamic individual to fundamentally change the relationship between the residents of California and their government. And also how state staff interact with the government as well, the resources that they have, and really shifting from viewing things in terms of departments and programs and really thinking about people. And this is a natural progression in California. It's Governor Newsom's been a champion of this for quite some time. But the work in health and human services over the last probably half a decade or so has really been pushing in this direction, as have other pieces of California government. And so over that time, we've partnered with Stewards of Change, who've been a great partner and good collaborator. They've helped us work through our interoperability issues in many cases. We started with open data with them. Always a good resource, good sounding board, and was really happy when Daniel came up with the idea of NIC. And as he said, California was one of the founding members of NIC. And the reason we were is that we think it's a great resource and a great environment that as we're doing this, we need to actively share our successes and actually our failures. And we need to learn from each other. And we need the space where this collaboration and conversation can occur. And it's especially important as more people, and Daniel's alluding to this, as more people get involved in this, and more work is being done, we really need a space where we can see what's going on, where we're able to learn from others and not have to start from square one every single time. And honestly, we all need support as we're doing this journey at some point. So it's a great space for that as well. So happy to be a part of it.
Thanks, Mike. appreciate your support and your ongoing efforts to drive collaboration, and over time we'll have hopefully some opportunities to hear more of the specifics of some of the kinds of innovative kinds of cross departmental and cross programmatic efforts that you've been championing there, which are really exciting, and I think a great model for other communities to really embed that work and the cross-domain kind of work that you're aware of and certainly supportive of. So really
and absolutely fundamental to what we're thinking as we shift to a person-centered design is that, you know, people have many touch points with government, and the traditional way of doing this is that you do it on a programmatic basis, and so your touch point with CalFresh may be completely different than your touch point with education and with social services. And so really trying to find ways that we can bridge across those silos and really focus on people.
Yeah, and I think especially with a state the size of California and the complexity of what's going on out there and the innovation going on, the more opportunity to sort of facilitate and support those cross-domain conversations will be a great model for us. We'd love to, sort of be able to represent those and encourage and engage people on the hub. And as you'll see later, we have a specific group for California that is on the hub, and so you'll be able to see them, be able to contribute to that. But as I said, there's other groups there as well. So again, this is a labor of love in development, and so it's everybody's participation who will help it really work there. So let me move on here to a tour of the hub itself. I'm going to just show you for folks who may not have come in yet. This is the National Interoperability Collaborative homepage. So there's a couple of websites. There's a Stewards website. There's a National NIC website where there's a lot of material and description of the overall efforts of the NIC, which is a broader initiative, and some new publications. But up here on the right-hand side, you'll see a button for Collaboration Hub, which brings you to this landing page, which is really the intro. And where if you haven't, you can sign in or sign up here, or as you invite other people to the hub, you'll be able to see that. And then when you go into the hub, this is basically what this is the home page of what you're seeing on the hub itself here. And I'm just going to spend a couple of minutes briefly kind of walking people through it. As I said, I'm hoping people have had a chance to go through it, but just to point out some obvious things here. There is up front here in the middle actually a virtual tour right now. So to take you through how to do some of the stuff, posting different things, and where things are located. So you can take that tour at your leisure if you need further clarification for it. You'll notice on the left side over here some upcoming events. And if you click through to that, you'll see both current events and past events. And on those past events are a lot of the resources that we've developed and we've provided to folks through the hub here. The really exciting part here are the groups. We currently have 7 groups operating with over 500 members. So you'll see there's kind of place-based groups. So there's a New England chapter that's kind of building out from the New England meeting that we held. Focus on that area. There's a California chapter as well that we're continuing to build, and then there's topic specifics like this new group, which is Let's Get Technical, which is a conversation that's building out of the San Diego event that we're beginning to assemble folks around to, and opioid prevention, social determinants, and confidentiality and privacy. And you can see the members there. We'll go into one of those groups in a moment. Actually, our consultants will go into them and show you around more specifically, but they're all fairly similar in their structure, but they're customized as well. There's some videos, some current videos, and some other interesting materials, a mapping of the opioid epidemic down below. And what we've got here in the middle is a topic of the week. We've recently added this to start to facilitate an overall conversation we want to have, or we want to at least provide people, in addition to the individual conversations that are happening on the groups. And this is just one of the murals that we created during the San Diego event, and this one is on race equity and disparity, a critically important topic. We hope, again, this may spur some conversation, some thoughts, some posting of ideas, papers, those kinds of things. Some materials, these are all the murals from San Diego. And then you'll find some discussions and highlights from the groups, and then a blog. There's a section here for a blog that people can contribute to. You can, and hopefully participate in the social media up here. We have both a Twitter and a LinkedIn group and a YouTube channel with lots and lots of videos around many of the topics. We have a leaderboard in terms of the top contributors. And then in terms of our activity board, you can see there's a lot of activity that's going on, people joining the hub or posting articles or responses like that. And you can go through that and find out more. At the bottom, there's a place to report issues. And on the bottom right-hand side, there's an option for sort of chatting with Sundays and our support if you have any particular problems. The main navigation across the top here is pretty self-explanatory. There's an about, there's my page here where you can, and I'm not going to go into all of these, but you can go in and you can make edits to your profile as you get comfortable with that. And you can do that over here in this options section here, where you can edit your profile, upload different things. And as you go in, you can see other people's profiles, learn a little bit what they're interested in, the domains that they're interested in as well. I'm just going to spend one more minute here on the forum. This is a place for general conversations right now, where you can post an idea, a concept, and then also invite people to engage in conversation. So there's a bunch of these that are happening right now. There's a blog section where if you feel motivated to put up a blog, talk about the kinds of things that are happening. I said events, groups that you've seen before, videos, photos, and then members. And I'm just going to look at members for a second here before I turn it over. So we've got a map of where all the members are. So you can see that we're actually not only in North America, but participation from more broadly than that. And then down below are the members. So you can see as you click in, you can search for members, and you can search in the newest members. You can look alphabetically. Some people have put up their photos, others have not. But as you can see, we have a whole bunch of new members here. You can friend them as well and engage in direct conversations, either on the hub or off the hub as well. And then we have an FAQ section here as well. So without going into a lot more detail on this, I'm gonna hand it over to Sundays and some other folks to kind of dive into more of the details on this. And so I encourage you to participate in that. And with that, Sundays, take it away.
Thank you, Daniel. I'm going to start my timer. So good afternoon from the East Coast. I'm going to touch on some of the topics that are dear to my heart in the next 5 minutes. I would love to elaborate further on these and others, so I will start the discussion on the hub right after the open house, and I am also producing a vlog. Just a quick intro about myself. I joined Stewards of Change about a year ago as the online community manager for the Institute and the NIC. Given my versatile profile, I wear several hats. I provide strategic and technical expertise to leverage the Institute and NIC's communications assets. I also help the organization's online platforms and channels. I have 23 years of experience as a digital communications and engagement professional, including 10 years of international experience. I am very passionate about digital communications, how to use online movements to trigger actions on the ground and positively impact people's lives. So you may learn more if you are interested and want to connect with me on social media and the hub. I will leave my contacts in the chat. So one of the first questions that might come to our mind, why did we build the hub and what's in it for me? The hub is a part of the NIC's online properties. It is at the heart of the NIC's work. Technically, it is a web-based platform launched in September 2018. Some metrics are showing on the screen. Daniel, please. Thank you. It aims to connect members of NIC's unique community of networks, materialize the concept of interoperability in the healthcare industry and boost progress across NIC's 6 health and wellness domains. Just a few of the numerous benefits of the Hub: sharing and discussing ideas, projects, and best practices amongst professionals, learning from each other's experience about what has worked and what hasn't, gaining exposure and forming mutually beneficial relationships that could expand our knowledge and further our work, identifying projects that might inspire and trigger our interest to contribute, accessing health and wellness related information remotely, and saving precious time needed for actions on the ground. Ultimately, the value of involvement is being on the front lines of accelerating progress to get further faster. To that point, nowadays we are drowning in information while starving for wisdom, so it is a no-brainer that communications is being ditched for engagement because we have less time to choose. People turn to peers when time is short and the risk is greater. According to a study, we trust peers the most at 57%, and only 13% trust advertisers and marketers. So people buy trust. Trust drives preference. 91% buy from trusted companies. Trust drives the choices we make. So where am I going with this? This is what we want to build through the Hub: sustainable relationships amongst our unique community of networks founded on care and trust that comes through and also leads to better engagement and collaboration. And that again will expand our knowledge, further our work, accelerate progress to get further faster, saving precious time needed for actions on the ground. So having said that, if you haven't already, please sign up to the Hub. Once you do, check out the quick tutorial video, connect with peers, tell your story, spread the love, invite your colleagues to join and share your posts on social media. Let us know if you want to have your own group set up. It could be a public or private group. It is free. We will be adding more specific tutorial videos to maximize the use of the Hub features. We will continue working on improving your experience and mixing up the content, adding vlogs, podcasts, infographics, and more. So one last thing, with your help, of course, through the Hub, we aim to bring NIC's community together. As NIC's network expands, the Hub will ultimately become the one-stop platform for health and wellness related discussions. Over time, we aspire for NIC's Hub to have a significant impact on the healthcare industry and contribute in improving people's lives. So I have 30 seconds left for my time, so please feel free to ask questions in the Q&A session and connect with me on the Hub and on social media. And I'm going to hand it over to my colleague, Ivy Poole. She's leading the confidentiality and privacy group. Ivy, take it away.
Thanks, Sandes. Hi, and it's nice to meet you all virtually. My name is Ivy Poole. I'm a senior consultant with Stewards of Change. My background, I'm a resident of New York State, and I come from New York State, where I was the program director for New York State's integrated eligibility system. Prior to that, I was the co-founder and executive director for a program in New York City called HHS Connect, which was one of the first data sharing and interoperability platforms that connected 12 different agencies in the health and human services and related domains. I'm not a privacy expert, I'm not an attorney, and I'm not a technologist. I'm a project manager and a program leader, like a lot of you. And so I'm always looking for actionable solutions, and I'm looking for common sense ideas and things that have worked. And so that's kind of what this group is focused on. The confidentiality and privacy group within the NIC Hub is a place where we can, as practitioners in this field, come together to talk about what are some of the challenges and opportunities and what has worked and what has not worked when we tackle issues around confidentiality and privacy with regard to data sharing and interoperability, with the sort of common goal and understanding that it is our objective to share information that will improve service delivery, but to do so with a constant vigilance towards what can and can't be shared and the requirements around protecting the privacy of those who we aim to serve. And so that's what this group is all about. I don't have very long to speak, so I just wanted to highlight a couple of features within this group. And I will say that we are, I think, 281 people strong today. So we'd love to get some additional folks to join our group. We have here, this is our homepage. We also have a tab that's available for resources. Within the resources tab, it starts at the top with some resources that have been created by the Stewards of Change Institute and NIC. So some of the actual work products that come from us. But we also have the opportunity down here at the bottom for you to be able to share your own resources. And so you can see I've actually included the links to some of the work that I've been involved in over the years, and others have as well. So if you know, we're kind of trying to crowdsource those kind of best practice examples of things like interagency MOUs and data sharing agreements, things that others can build on that have successfully worked in the past, understanding, of course, that there are differences between and among states that make it necessary to revisit and tweak all of these things. But it's always good to have a starting point when it comes to things like creating use cases and creating MOUs. So that is what the resources that are available here is for. We also have a forum where you can visit to ask questions. As I mentioned, we're 281 strong today. Hopefully we are growing. And if you have questions or sort of information that you would like to share with this group, this is the place to do it. And so the first question here is actually something I'm pretty excited about, which is that the Stewards of Change Institute is currently working on developing a confidentiality and privacy playbook. And a playbook, as we all know, is sort of a book of the successful approaches that have been used in tackling issues of confidentiality and privacy. And so we are putting a question out there to all of you in this forum. If you can weigh in with, if you have plays, if you have approaches or examples of things that have worked well in this area, we would welcome that conversation here. And then the last thing I just wanted to point out with regard to this group is that we do have a blog, much like there is a blog on the homepage for NIC. We have a blog that is specific to confidentiality and privacy. Would love to get some posts up here. So if you have a story that you'd like to tell, if something has been successful in your state or in your municipality, or if there's a best practice that you know of that you would like to write about and share with this group, we would absolutely welcome that sort of storytelling aspect to this group as well. So that's the confidentiality and privacy group. That's what we're all about. Would love to get some new participants in this group and some new activity. So please come join me. And I promise I will do my best to moderate the conversation and to give you some feedback and hook you up with others who can do so as well. Thanks. Now I think I am handing it off to Adam Pertman.
Hi, thanks, Ivy. First, I'll start by echoing a lot of what Ivy said. The same functionalities that are in her group are in the opioid group as well. And you heard the list of them from the blog on down. One thing that I will add, and then I'll jump back to introduce myself, but before I forget, one thing I want to add is this is also a place where you can share resources. I think and that's true for all of the groups that we've put together. If you are working on a project, if you've run across a resource, a paper, a how-to that you think would be valuable to other people, please, we want to see it. This is a place where you can post it so that you can share widely with other people, because there aren't a lot of places to do that across domains with similar interests on similar topics. And we hope that you will come to the hub to get those for yourself as well that come from others. So my name is Adam Pertman. I've been with Stewards for several years. My function in a senior consultant capacity, my function with NIC is as communications and coordination director. And I guess those describe what I do. And part of that function is co-leading this group. My background, very quickly, is 20-some years as a journalist, most of them with the Boston Globe. So a lot of writing, editing, research, sort of at a journalistic level, in a journalistic manner. Then I went on for a dozen years to head not-for-profit in the child welfare space, a national think tank. And now I bring whatever it is I learned from those two careers to Stewards, and it is one heck of an exciting opportunity. The NIC in particular, I think gets people going because it fills such a void that everyone I've met over the years in this role has said, you know, what we need is a place where we can fill in the blank, and that's what NIC was created to do, to fill in that blank. So one other relevant piece is that because of my background and the work that I've been doing with Stewards and with NIC, I am the editor of the opioid playbook on which the one that Ivy just described will be based. That is published. I'll get to it in just a second, but so that's part of my function with the organization. And I do urge you, those who are interested in the crisis, and I guess we all should be at some level, to really take a look at that and contribute to it as your work, to the extent that your work is relevant to it. When you think about the opioid group that we formed on the Hub, and by the way, there are 347 members, so the interest in it is pretty strong. We invite more, we want more for sure, but this is a topic that has really drawn a lot of people across a lot of domains. So we're hopeful that this will make a real difference and serve the sort of cross-domain function that we hope they all do. But when you look at it, it's clearly aimed at opioids per se, but we urge you not to think about it that narrowly. Our intent in putting out the opioid playbook, as well as this group and all of the work that we do, our intent is twofold. One, to show that interoperability, information sharing, and so forth really are critically important when dealing with a large problem, a large issue like the opioid crisis, but not restricted to it. And second, our sweet spot, if you will, the place that we've chosen to focus our work is on prevention. So you'll see that in the opioid group, but again, we hope that you don't think about it as opioid focused solely. The idea here is if we think about the broad ways in which we can deal with a crisis, especially at the early end, especially upstream, those are then applicable to other crises, to other emergencies, to other situations. And that's how we mean this group to unfold. If there are participants who want to see how this will apply, the learning here will apply to other work that they're doing, that's exactly what we want to happen. And if the work you're doing you think is applicable, especially in a prevention mode, to the opioid crisis, we want to see you there and we want to hear your ideas. So the other work we've done in this realm includes, not limited to, a webinar that we held on the topic. The recording of it is available. I urge people to listen to it if you have an interest in this. And we are planning additional webinars. So if you are interested, if you have topic ideas, if you want to focus in on this with us, we welcome you with open arms. The same is true for the playbook itself. It is meant, as Ivy explained with hers, it is meant to be a, how do we put it? It's meant to be a living, breathing entity. So we want to keep it updated. We want to have new plays. We hope people will use the ones that we lay out, but we also want to keep this living and moving so that it's genuinely useful. And finally, I just want to say that the enthusiasm that we have seen, in particular for the opioid group, but for all of them, is really heartening. We see that void that I mentioned earlier really being filled. And we hope that all of you, as you listen to this, as you look at the Hub, as you look at the separate groups, see not just a way to help build an organization that can make a real difference, but to build an organization that can genuinely help you in your work every day. So thanks for the few minutes here, and I will turn this now over to my colleague, Nava Stein.
Hello. My name is Nava Stein. I'm the moderator of the Social Determinants of Health group on the Hub. I've been working for Stewards of Change for the past 3 years or so as a research assistant associate consultant. I've helped to build the NIC, and I've helped to begin building this collaboration hub, and I support the repository as well. And so Social Determinants of Health group on the Hub, we have a lot going on, which you've already heard from my colleagues. We have a forum in which to ignite different discussions. We have videos, we have different graphic murals that tell the story of past conferences and discussions we've had. A number of months ago, we hosted a webinar with 2 different experts from Canada that talked about social determinants of health and the return on investment through moving dollars towards social spending away from healthcare services. And they were able to provide data to show how much social services actually are able to improve lives. And that webinar is available on the Hub if you'd like to go back and listen to the recording. We also are trying to share weekly or bi-weekly updates about juicy content that is happening that is in the realm of social determinants of health. And we're figuring out how to make that relevant and exciting. I'm inviting everyone to really start participating in the discussions that we do have on the Hub. Right now we're feeding a lot of information, but I think it'll be really beneficial for all participants to really actively participate and ignite conversation through thought-provoking topics, and to add to the repository and perhaps share information about your own personal projects, successes, and failures. And you're also welcome to add blog posts. Moving forward, we're hoping to integrate information more about health equity. I know a number of you from the beginning poll of this course so that you had attended the 211 San Diego conference. And we did have that lunch plenary with a number of speakers who brought up equity, and it's definitely perhaps uncomfortable topic, but I think really is the baseline for talking about social determinants of health. And so we're starting to think about integrating that kind of information and conversation into this group as well. And so moving forward, I urge you to participate through adding information, adding questions, starting conversation. And with that, I pass it back over to Daniel.
Thanks, Nava. And thanks, Sundays and Ivy and Adam. I hope this gives you a little sense of the groups. There's a lot of energy going on around it. And what I want to do now is just kind of go back to the slides and actually open it up for some conversation momentarily in terms of what we got going here. So I did want to point out one thing on this slide here, that amongst the members, we also had, we've had over 40,000 page views and over 4,000 visitors to the site. So there's a lot of people coming, a lot of consumption of material, which is really exciting and interesting. The last couple of slides I'm going to put up here before we get into some more conversation, and hopefully folks will be interested in asking some questions and seeing how they can get involved. One is you know, how you can get involved. Obviously, be joining. Feel free to join any one or more of the groups that interest you. And we are also looking for more people to help curate and facilitate the groups. We think one of the things that's really interesting is for people to participate in the conversations. When we've held webinars in the past, we've had several hundred people attend each of them, and that's generated a flurry of activity and interest. So for folks who are really interested in a particular topic, please contact us, and we would love to have a couple of people being able to curate the various groups. And we hope to move towards having conversations between the various domains, which is something that I would love to see us be able to host those kind of conversations in a way that that really facilitates the kind of conversation in a way that I don't think actually presents itself very often, because everybody tends to stay in their own lane and not necessarily cross domains. We're also starting this topic, this approach we're calling an incubator, and we've just started to do this with Let's Get Technical group, which is when there's interest in a particular topic, we want to assemble a couple of folks who have a strong interest in it, get that started, and then sort of mature that to a full group as we go forward. And of course, you can join as a member, a partner, or a sponsor in whatever ways, and all that's clearly delineated on the NIC site. So with that, let me just, I know we're getting close to the hour here. What I would love to do is ask folks, I'm going to do one more quick poll, and then if there are questions that folks have, that would be, I'd love to hear that. Maybe we're not going to do that second poll here. Stop, share results. Nope. Guess what? Poll 2. Here we go. So this is just a very quick way for you to kind of signal your areas of interest. If you don't mind, we'll follow up with you. So we know that some people want to consume material, others want to participate in webinars, moderate a group, contribute to a group. Feel free just to, no obligation required, but just to get a sense of where folks are. If you have a sense of it right now, whether you'd be interested in writing blogs, participating in a webinar series, reviewing and studying work groups, potentially planning a chapter. We have a chapter in California that we're building, and also in the New England states. And that's very, very exciting to be able to bring people together around that. I just give you just another minute or two for folks who want to contribute their ideas if they want to. You can choose more than one area as well. All right, going once, going twice. Last comments, last moment to contribute here. All right, I'll give you one more moment as you read through these things. Okay, so here's the results of our polling. People are obviously interested in the webinars. The highest one is contributing content to the groups on the site, which is terrific. We look forward to that. And more posting of comments. A couple of folks are really interested in participating or building a chapter, so we'd love to hear from you directly. One of the ideas coming out of San Diego was that we held a lot of sessions. Stewards actually hosted about 8 sessions. We have the murals and the content of that, and we want to make that available to folks and sort of reprise those if you weren't able to participate, and to hold a series of seminars, potentially through like a weekly or a bi-weekly kind of open house, and present topics. And again, we would be very interested in your thoughts and recommendations about that. And so I'm going to stop sharing that right now. And what I'd love to do is get your thoughts on what's next, or if there's any questions at the moment here. Time for discussion. So here are some of the things that we will be doing. I'm seeing some comments on the chat box. If anyone has a direct question now, I can unmute everybody and feel free to join in. What we'd love to do is have you, we had a lot of material to cover today, but we'd love to have this become more of a conversation. So